Combat Blindness International has been doing the remarkable work you just saw for 30 years this year. And you'll learn more this morning on For the Record. Good morning, I'm Neil Heinen. The mission of Combat Blindness International is nothing less than eliminating preventable blindness around the world and returning vision to impoverished people, empowering them to live happy and productive lives. You'll learn about how it's done, about the 30th anniversary, and about a special event coming up. But CBI was started by UW-Madison Professor of Ophthalmology and Visual Sciences, Dr. Suresh Chandra. And Dr. Chandra joins me this morning, along with CBI Executive Director, Melissa Witte. And thank you very much for being with me.
Thank you.
Dr. Chandra, I think it would be great if you could just start with the inception of Combat Blindness International. How did it start? Why did you create this?
Well, I came to Madison in 1974 and joined the department and university as an assistant professor. And I trained as a retina specialist. And in a few years, I felt that I should give back some. So I traveled in different developing countries. Of course, my native land, which is India, I used to go there every year. I traveled to Africa, I traveled to Thailand, Indonesia, and many other developing countries, just to teach them how this new modern surgery is done for retinal problems. And quickly I realized that this is not the blindness problem. This is a very small part of the blindness. The major part of the blindness is very different, which is cataract, which is half of the world blindness. So if you treat cataract alone, you're treating half of the world's blindness. And that was very, very important for me to see that when I see these hospitals and see how these people are being treated. And then in the developing countries, when I found that, my gosh, it costs so little to do this surgery, it was really a very compelling thing. It really spun my mind, and I just thought that I have to do something about it. And that's when we started Combat Blindness International. I had a very good community support, my friends, my patients, and everybody just pitched in. So we didn't have really a difficulty in starting the project.
Now, it's probably important to acknowledge that in developing countries, blindness is a much bigger problem than it is in the United States.
If you take the blindness in the world, 90% of the blindness, as you showed in your intro, is in the developing countries. Mm-hmm. And the good news is that 80% of this can be cured or prevented. So that was another exciting, my gosh, we really have a good shot at it, that we can do something.
What have been, how do we understand the barriers, the causes of blindness in those countries, and the barriers to what you say is a pretty simple remedy?
Yeah, well, as you know, in all the developing countries, one of the major problems is money. They don't have enough resources that they can provide health care to these people who live in the villages, in remote areas. Leave aside the eye care. Eye care comes very last in the ladder of health care.
Yep. And also access too. There's facilities around the world, but there are so many villages and outlying areas that it's hard for folks to even get to, a place where they can be seen at. There is one of the patients that Combat Blindness provided funding for free surgery was in Gujarat, India. Her name is andMelissa. She was 8 years old and blind since birth. Her parents had no idea why she was blind or couldn't see. Her mother could not work in the fields with her husband because she had to stay home and take care of her daughter. One of CBI's camps came around and they were doing screenings, screened their daughter, and were able to say, it's cataracts. It's a simple procedure. Took her to the hospital, and with $20 from Combat Blindness, we're able to provide her sight. Manisha is now back in school. Her mother is now back working with her husband in the fields, which is their livelihood. And I mean, effectively, we have reduced poverty along with all of those other things that are great.
Total life changer.
Yeah.
But now that raises a question. I didn't. Cataract can people, someone young, 8 years old, can have cataracts.
Cataract can have involve the younger people too.
Okay.
Although it's mainly in adults, it's an aging change, but in young people we see a lot of cataract.
Yeah.
Another problem that in these countries you will see is, as Melissa said, access, but also literacy. They're not educated. They don't know whether there is something can be done.
Yeah.
And in India particularly, you know, I remember that in the early days, they used to say that, oh, God wanted that way.
Yeah.
They just reconcile.
It's part of the culture.
Right,
of
and
the
you just live
culture.
with it.
So I think there are a number of barriers, and I think we are trying to break those barriers as we move along.
But it's absolutely essential that you go there and go into these places where
Right, go into the villages, go to their backyard.
Although we've talked a little bit about the potential for maybe reaching more people now with modern technology to the extent that it's available, that they might become aware that this is available to them. That maybe that will get a little easier these days.
Absolutely. I think that's one other thing that we are doing to reach these people is that we are having partners in India, non-profit organizations, where we have given them the vans to go screen these people, bring them back, operate, and provide them with all the surgery free, and then bring them back. So I think that helps in a way that these healthcare people who go to screen them explain to them what it is, what you need to do, what we need to do, and it really works.
Right, and that I was just going to piggyback on that. One of the things that we do is it's not us going to do the procedures, it's us partnering with those who are already there.
Sure.
So it's people, you know, they know them, they are from their area. It brings a little bit of comfort within that.
Well, when
too.
we come back, I want to talk a little bit about this remarkable organization being here in Madison and how it works, and we'll do that right after this. This year marks the 30th anniversary of Combat Blindness International. There is an anniversary event coming up we will tell you about and tell you how you can participate in it with a fascinating featured speaker, keynote speaker. My guest, Dr. Suresh Chandra, the founder of Combat Blindness International, and Melissa Witte, who is the executive director of CBI. And how long have you been with the organization, Melissa?
6 years.
So the idea that this has been here 30 years, that it has this global presence, and yet I'm not sure how many people really appreciate that it's headquartered here. Talk about the foundation of it, how it operates, how it's funded. What do we need to know about it?
Yeah, one of the things that I appreciate about our organization is I love being a part of Madison, where most folks in Madison are very, nonprofit, socially justice minded. But I think one of the things that we tend to forget is that the world is our neighbor, and that by helping people in the world, we are also helping us in Dane County as well. We at Combat Blindness, we have projects all around the world, but we also have a project here in Dane County because we think it is important to both take care of those that are our neighbors globally as well as our neighbors physically in our backyard. The organization is filled with volunteers who have a heart for what we're doing, for those who see individuals and hear the names and the stories of those who were blinded, and within 20 minutes their lives are completely changed. They can go back into the workforce, they can go back to school. One of the things that we've kind of thrown around here is that it only costs $20 to do these surgeries internationally in the developing world. And so we have found that this procedure is this medical intervention has the highest economic output and is the most efficient of procedures as
maybe
well,
we should
all
be
in
really
one.
clear. The patient does not pay that $20.
Yeah.
I mean, as remarkable as that $20 is, it's the donations to the institute that fund that work.
Exactly.
The partnership is very important because that gives us a sustainability. Previously, we used to go do the surgery and come back, and that's the end of it. Now finding partners who are thinking along the same lines, our work is continuing all year round, and we go and we send volunteers as they come every year several times. But that has given us a way to work all year round. And that has enabled us not only being in India, but also in 7, 8 other countries in 4 continents.
Yeah.
So we want to have people who really are interested, who really are genuine, and go out and work with the foundation, and then go out
Right.
and work.
One of the things that I love about this organization as well is that we look to make it more sustainable every year. When the organization first started, you would go in and do cataract surgeries by removing the cataract and then providing those Coke bottle thick glasses,
Right.
which provided sight, but it wasn't a sustainable thing. If the glasses were broken or lost or stolen, the individual was back to where they were when it began. And so Combat Blindness had the idea of, well, here in the US, when we have cataract surgeries, we have an intraocular lens replacing, so we don't have to worry about glasses. It wasn't affordable for us to be able to have intraocular lenses or IOLs sent overseas, just cost prohibitive. And so what can we do about that? So we worked with 2 other partner organizations here in the US and partnered with a hospital, Arvind Eye Hospital in India, and said, what about you building an IOL factory? And so, years later, here we are. They are it's called Aurolab. They are one of the premier intraocular lens and suture factories. They even distribute their IOLs here to the US.
In India.
India. And now we're able to do procedures with IOLs. And again, this is just internationally. It only costs $20 here. It's a little more expensive on this side of things, but yeah, it allows us to.
Those intraocular lenses, they cost here at the moment is about $150, but we have brought down the cost to $2. So now it becomes suddenly affordable for all the patients. We can do it. So the surgery that we are doing in India is not any different than what we do here, which is very exciting.
Yeah.
Is fundraising a constant effort?
Most definitely.
Yeah. Where does your money come from?
From the usual realms of individual donations. Some foundations have provided work, and then our event that we have coming up is a big fundraiser for us, and it allows us to do a lot of work here locally as well as overseas by what the funds
We're
we
going to
raise
talk
there.
about the fundraiser, but if people went to your website, they would find an opportunity to contribute and to donate.
Yep, and you think about it, right? It's 4 lattes or somebody's sight.
Yeah. So I mean, it's a mix of private individual donations, which you probably can't count on for big sums of money, and but foundations or healthcare providers or all of the above.
Foundations. Some of those foundations are from the medical community. Sponsorship for our event is where we get into some corporate sponsorship. UW Health being one of our major sponsors that we have, and so.
I don't want to put words in your mouth, but the idea that so many nonprofits are judged by the efficiency of their use of dollars. This seems to me like a pretty efficient organization.
Exactly.
Yeah, one of the things that really impresses me and really keeps me going is that in $20 you provide sight who is not able to see anything, and next morning he's able to see. And he's not productive member of the community or even the family. So he's now interacting, taking care of his grandchildren and children. And then the economic productivity is very different. We did a study where we found that when you spend $20 on this person, in the first year alone, he makes $300.
And that's a lot of money.
Well, that's a
That's a lot of money.
1,500% return.
Yeah.
1,500% return in the first
Hard
year.
to think of a better use of 20 bucks.
I know.
We're going to come back and talk about the special event right after this. World Sight Day, the annual observance, is coming up in October, and this year it coincides with the 30th anniversary of the Combat Blindness International here in Madison. My guests, CBI founder Dr. Suresh Chandra and Melissa Witte, who is the executive director. Melissa, if you would, tell us about the event, tell us about Mr. Michaels and what we've got coming up.
Yeah, we're really excited about the event.
Is it October 1?
October 1st, yep. And it's going to be at the new Edgewater, so we are excited to be at that new venue and to be able to experience
an added attraction.
Yeah, added bonus there.
Yep.
We have Lon Michaels, who is coming. He's a Wisconsin-born artist who in 2003 suddenly lost his sight within a span of 15 seconds. He was painting a work called Freedom, and he was went blind.
Yep.
And for 2 years he had to relearn how to do everything from painting to just his regular day in and day out work. And thankfully, due to some support and some friends, he was able to have a procedure done that restored his sight, and so he's now able to paint again. But we are excited to hear his story and hear his creativity behind it, as to be able to share with us, this is what life was like blind. And for me, here's what life is like now seeing, which a lot of our patients, individuals we work with, get to see. So we're super excited to have him come and join us. It's a very fun event. It's a very celebratory event. One of the things that we enjoy is our fanfare of food is from all of our locations that we're at in the country. So we have African food, we have South American food, we have Indian food, and so if you got the palate, it's quite delicious. That's most of the folks end up raving about our food kind of the end of the event. Our silent auction items are filled with beautiful crafts from those areas as well.
So what's World Sight Day?
World Sight Day is an annual or international event just focused on letting folks know that blindness is an issue in the world, and there's something that we can do about it.
Is it connected to CBI, or was this
There is an organization, International Agency for Prevention of Blindness, and World Health Organization picked the day that in October we will celebrate the World Sight Day to make blindness be aware of blindness and what they can do about it. So we really celebrate like telling everybody to know what the blindness is and what you can do to cure that blindness. So it's really an international event going on all over the world.
Yeah, that's cool. Tickets are available, and go to the website and to get tickets.
Yeah, combatblindness.org/events is where they're at right now, and it also shares more about what's going on the event, and so folks can kind of get a tickler.
Edgewood is not a huge venue. I assume people should act rather quickly if they...
Correct, Edgewater, not Edgewood.
I'm sorry, Edgewater.
Don't need folks going to the college.
Edgewater.
Yeah.
Dr. Chandra, the numbers seem daunting. As much as you're doing, it must be frustrating that there's so much more that could be done. What's possible?
Well, I think, we are really doing a small part on our part, but there is so much possible all around the world. We are in few countries. We can go in other countries. We can really expand our programs to really reach people who are otherwise unreachable. So the limit is, we can really do a lot of work, and with the support of the community and people here, I think we have an opportunity, really.
Yeah, because kind of what we talked about too in the beginning, the world being our neighbor. There are so many individuals here who, back in their home area, they know of this problem of blindness. I think of individuals here who we have talked to that work in Nigeria. They live here, they work in Nigeria. You know, those are places that CBI would love to expand to and help in those areas, but we need the society to help us with that. It's not just us on our own.
I think it seems pretty clear that the more money you have, the more work you're gonna be able to do. But as we become more global in this sort of cliche that we're all getting ever more familiar with, that should offer opportunities.
Exactly.
To do this
And the
work.
other thing that I think I want to just bring it up is that we want to make a change which is sustainable. So even though cataract is a big problem and other blindnesses are a problem, we want to make sure that we create ways that we can make it sustainable, like training people. Ophthalmologists, for example, paramedical personnel, we are working in that direction. Infrastructure, you know, all these developing countries, there's no infrastructure. So we are trying to start small hospitals where people can come and see at their own, you know, situation and surroundings.
Right, like I think about the training of individuals. You know, here to see an ophthalmologist, you call up your doctor, you see an ophthalmologist. In India, there's only one ophthalmologist to every 100,000 people, and in Africa, it's one to every 1,000,000 people. So just the access there. So CBI has, you know, works to fund those.
We got to go. Remarkable work. Great. Happy anniversary. We're going to come back and wrap it up right after this. Combat Blindness International. For more information, we'll see you next Sunday on For the Record.